Hi everyone, this is Kate Warnock coming to you live from the Guidewell Insights Lounge. We're here on location at the Oliver Wyman Health Innovation Summit, and I'm so happy to bring Mr. Sam Glick to our interview. Sam, welcome.
Great to be here, Kate. Good
Sam,
to see you again.
Oh, so happy to have you. This is the second time at least that we have had you here at the Insights Lounge. So Sam, you have two titles with Oliver Wyman. I know that you are partner with the Health and Life Sciences Practices, and you're also the director of your brand new Leaders Alliance, the OWHIC Leaders Alliance. So you have big job for Oliver Wyman, but happy to have you here.
Oh, it's fun. It's a lot of fun.
So Sam, we know that the main theme for this summit is the consumer imperative and how it is transforming the health industry from the outside in. What is it that makes consumerism that much more important to pay attention to now?
It's a great question. We've been talking about the consumer in healthcare for a very long time. Actually, the first commercial health insurance plan is more than 130 years old in the US, and when that came out, there was great press actually about consumers being involved in their own healthcare and employees being involved. When Medicare 52 years ago actually launched, there were people going door to door to sign up individuals in Medicare. We've had 40 plus years of clinical literature on shared decision making. We've had telemedicine being reimbursed for 17 years. Hasn't always been popular, but it's been reimbursable. And so it's a really good question. And why talk about the consumer now if we've been talking about them for a long time? And two things have really happened in healthcare. One, the amount of the healthcare cost that individual consumers are now paying, of their own healthcare costs, has now crossed the line where, as of last year, the typical commercially insured American, the person who pays all the bills and then some in the system, is in a high deductible healthcare plan, whether it's called that or not. And so they're paying more than $1,300 a year if they're an individual, several times that if they're a family. And what that means is, in most years, they're paying most of their own healthcare costs. Right? Most people aren't sick every year. Most people aren't going in every year. They certainly need insurance in those big years. But the rest of the time, they're going in and they're paying all of their own costs. And that fundamentally changes how they think about shopping for healthcare. Healthcare used to be when somebody else wasn't paying, was paying most of that money, when somebody else was covering most of it, consumers just chose, do I go to this hospital or this hospital or this hospital? Do I go to this doctor or this doctor? And now what they're saying is, do I get health care? Or do I get new tires? Or do I go on vacation? Or do I get a new iPhone? Or do I do any number of things that I need and want to support my life? And so now they're shopping for health care against everything else they buy with their own money. And so the onus is now on healthcare and healthcare providers like everybody at this event here at the summit to really be competitive with all of those other things that consumers see. The other reason I think we're talking about it now more than ever is it's actually easier to do that than ever. The cost of starting a digital health startup, which might have been $50 million just 10 years ago or 15 years ago, you can do for $500,000 and rent the data processing technology you need and the cloud platforms you need. We now have everyone who has a mobile phone in their pocket. And 10 years ago, the iPhone didn't exist. Couldn't have happened. And so we have all these ways that innovators can reach people, engage with people that are lower cost and more present, and that combination is a pretty powerful thing.
I agree, and obviously, you bring such wonderful speakers here, and there's so many different aspects that you're going to be exploring here over the summit. One of those I hope that you can kind of help flesh out for us is, we still have enterprises that are very inward focused. They have to meet their P&L, they're maybe more operations focused. How is it that we help them shift to having that consumerism focus?
That is the trillion-dollar question, quite literally in healthcare. And first, I think it starts with acknowledging that most people got into healthcare, whether they are clinicians providing care, they're IT people installing enablement, they are financiers who thought about health insurance, whatever their expertise, got into healthcare because they cared about people and they wanted to help people. Everyone who works in healthcare is a healthcare consumer themselves. And so what you can't start with is a healthcare's clueless, people just don't get it kind of attitude. We ended up here for a very good reason, which was we, over the past several decades, had huge growth in healthcare costs, and we built a system that was optimized around streamlining what we did to at least be operationally efficient. We saw lean move from Toyota into healthcare, and particularly hospitals, in a major way. We saw health insurers get ever better at segmenting the way their customers big groups segment. And so we ended up with a segmentation in health insurers that looks like what I call the Sizzler segmentation, which is how big's your party and are you over 65, right? Are you small, medium, large group, and are you a senior or not? And that wasn't an irrational thing. That's what you needed to do to survive in that world. And so part of what we now have to do is to say, healthcare adapted over the past several decades to serve a particular type of market, and we're going to embrace that that kind of change is required now structurally. The other thing that's really required is moving away from this kind of fortress mentality. There has been a lot of activity in healthcare over the years to bring in more assets. If you're a health plan, you want to bring in other health plan and increasingly delivery assets. If you're a hospital, you bring in more hospitals because you get scale. If you're an IT company, you bring in all the modules that fit on your platform. And real consumer businesses don't own the whole fortress. They don't do that. Even the biggest retailers in the world that we think of a Walmart, think of an Amazon, get together every year with their suppliers.
Right.
They think about what's coming. They bring in innovative vendors. They view themselves as the one having a relationship with the consumer, but they don't have to build it all. Walmart doesn't manufacture its own stuff. Amazon sells as many, if not more, things that they don't actually make as they do, and it's a whole range and it's a curator. And I think we've got to change that mindset as well.
You know, perfect examples for my next question. Do you think that the health industry really can ever convert itself to being a service industry?
So I think healthcare is a service industry, and we have people who act that way. One of the biggest challenges we have is we in healthcare have taken people who get into the business initially or say they want to get into the business because they want to help people. We then train them to treat diseases, not treat people. And then most of the time, we hammer them about coding and billing. And so you take somebody who's 22 and idealistic and wants to go to medical school or wants to go to nursing school or decides they're going to take their engineering degree and get into health IT, or is an actuary and decides that they're going to get into healthcare, who really does want to be in a service industry and help people. And we beat out of them that kind of motivation. And we have to change that. We have 60% of healthcare workers now across the industry self-identifying as burned out, saying that they're burned out, and a lot of the initiatives we're doing around better experience, being more consumer friendly, empowering people, we have to turn inward on our own employees before we're ever going to have an impact on the patients and customers we see. And I think we're getting there. We're starting to see some organizations really work that way, but that's going to be a big part of the change we need.
You know, and again, what makes the summit so special, and I'm so glad to have you here as one of the leaders of it, is that you really do address all parts of all the challenges that the health industry faces, including the employees and its mission, and really trying to address the burnout factor. So I know that we'll hear a lot more of your speakers in the coming days address those in particular. So I have one last question for you, though, Sam. Okay, how does innovation play a role in addressing the consumer imperative?
So, innovation and the consumer imperative are fundamentally intertwined and codependent, and I'm not sure that we can think about them as even separate topics. A lot of times, I think when people think about innovation, you think about the sexy stuff. You think about the shiny new objects. You think about the apps. You think about the kinds of things that are kind of space age, if I can use that terminology. But innovation is all of the things that we just talked about. Fundamentally thinking differently about the workforce. Do we need to train people for different jobs? Do we need to motivate them differently? Do we need to change what it looks like to provide healthcare? Innovation is about moving from this fortress mentality to having all the IT we need to make a seamless experience and a seamless front door for people. Innovation is about engaging people differently. Going to the doctor's office is one of the most inconvenient things that somebody can do. They tend to be open banker's hours. Banker's hours are now doctor's hours. Bankers actually are open more than doctors in most cases. They are in locations that may not be close to work or home. And we have incredible ways in every other industry of getting people access to what we want to provide to them without making them march in somewhere. And so I think innovation in healthcare is going to be a combination of big innovation, the big scientific innovation that we see around drugs and delivery and personalized medicine, changing the science of what we do. It's going to be people innovation. We're going to have new roles and new professions. And if you and I are sitting here in 20 or 30 years, I'll be disappointed if we're just talking about doctors and nurses and not talking about a whole team of people who have different relationships with patients. And then it's about that kind of engagement innovation. It's about how do we reach people, how do we take the best things that other industries do and say, yes, those can work in healthcare, because it is now a consumer business. And I think that combination is going to get there. We're going to have a ton of failure. We have to get comfortable with that. But the bits that succeed, and I'm convinced there's at least a few that will succeed here at the summit, are going to fundamentally change the industry.
All right, well, Sam, such wonderful responses, and again, so excited to be here on location at the Oliver Wyman Health Innovation Summit. Thank you so much for joining us.
Thanks for having me, and thanks for being here. It's always great to have Guidewell.
Oh, we love being a part of it. My name is Kate Warnock. Thanks so much for watching.